Hello, I'm Professor Rusuligia from University of Craiova, and we are partner in the project's Erasmus Plus program, Clinical K for Electrical Stimulation in Physiotherapy and Rehabilitation. In the Module 1 of this course, one of the problems is healthy and enervated muscle physiology, and I will present some few things about pathophysiology of the nerve. Overview about nerve damage. The nerve conducts information or command in the form of an electrical impulse. How we know the structure of the nerve means fibers, nervous fibers that conduct the electrical impulse, afferent and efferent. The electrical impulse circulates in both directions, from the peripheral sensor to the brain and from the central nervous system to the periphery. The command from the brain to periphery is most often represented by muscle control. Only through the nerve we can move the body, make the balance, make the control, make the coordination. The main symptoms of a peripheral nerve injury or peripheral neuropathy include anesthesia of the skin area, means lack of sensibility, numbness, paresthesia, and in some cases patients complain of pain with different sensation. What are the signs? The signs are reflected by melting or decrease in volume of muscle mass. Amyotrophy. So the origin of amyotrophy is on the neurologic problem, it's on the level of neural. The abnormal position of the affected segment and the impossibility of performing specific movements are also specific signs of nerve damage. And you can see in the figure 1A and B, healthy neuron structure in figure 1E and unhealthy neuron structure in figure 1B. How we can see? You can see the body of the neuron and their dendrites that comes to the body, and the efferent system, efferent fibers, which is axon with many connective tissue. What causes the nerve damage? A damaged nerve can no longer perform its function. This is how the signs and symptoms intend to raise an alarm appear, which means that the nerve tells us that it is a pain. Nerve injury can be classified into several types. Section, when the nerve is cut, crushing or stretching in trauma, blows or strong contusions, compression, pressure on area due to the tissues that surrounded it. Neuropathy is a group of diseases generated by nerve damages in different situations. In one of these three cases, section, crushing, compression, that affect nerves outside the brain and spinal cord, peripheral nerves. Mononeuropathy describes the condition in which only one nerve or nerve group is damaged. This disease affects the part of the body associated with the nerve or nerves, causing a loss of sensation, movement or function in the part of the body. Mononeuropathy can affect any part of the body. Types of neuropathy. How we said before, the neuropathy involves the peripheral nerves. So this is the system for conduction, the information from the receptors and come back to the effectors, means muscle. There are two types of neuropathy. When symptoms develop slowly, it is called chronic neuropathy. When symptoms suddenly appear, it is called acute neuropathy. Neuropathy can be inherited. The most common form of hereditary neuropathy is Charcot-Marie-Tooth disease, in which a group of motor and sensory neuropathies that affect the arms and legs. Acquired neuropathy is much more common and is usually caused by disease or injury. Nerve damage caused by diabetes mellitus is called diabetic neuropathy. When the cause is unless, it is called idiopathic neuropathy. Peripheral nerve injury can occur in the context of mechanical damage such as compression, traction or direct injury, or in other contexts such as metabolic disease, injuries caused by electric current, radiation or poisoning. Secondary to nerve damage, nerve conduction capacity is completely or partially lost, and in this case the communication with the innervated peripheral organs disappears. These lesions were first described by Seddon in 1943 and divided into three categories: neuropraxia, axonotmesis, and neurotmesis. And now let's see what about for each of these. What is neuropraxia? This is the least severe nerve damage, because here the treatment, the time, the physiotherapy intervention could help restore the nerve function. So, it is the less severe nerve damage and is characterized by a focal nerve conduction block. The injury is located strictly at the level of the myelin sheath, the axon preserving its integrity and its entirety, so that there is a deficiency in the transmission of the action potential along the nerve fibers. This type of injury can also occur as a result of maintaining an unnatural sleeping position that exerts additional pressure on the nerve fibers for a long period of time. The second aspect is axonotmesis. This type of injury involves the sectioning of the myelin sheath and axon. From a morphological and functional perspective, the connective tissue that covers these structures remains intact. This type of injury is characterized by preserving the continuity of the nerve paths through a mass of tissue. Secondary to the lesional particularities, spontaneous regeneration processes are present. Many times, nerve injuries such as axonotmesis are secondary to a complete fracture in which the resulting bone fragments exert pressure directly on the nerve pathway. Neurotmesis. This type of injury is defined by a complete destruction of nerve structure. Both the myelin sheath and the axon together are damaged, and also connective tissue, and this generates a very serious damage of the nerve and in many cases are irreversible. Something about nerve composition. The nerve is a which-is cylindrical cord made up of nerve fibers. Nerves, together with nerve ganglia, small swellings along the path of the nerve, constitute the peripheral nervous system. Like you see in figure 2, here is the component of the neuron. Unlike the central nervous system, which is made up of the brain and spinal cord. Nerve damage during aging. Exactly like in muscle, we assist in the aging process to nerve damage. Aging, which is a normal process of physical change over time, can give us an image that are not very favorable, because some of us can can age passively without paying much attention to the process or actively by consciously making certain choices and taking great care of your own body and mind. Starting with the third decade of life, the weight of the brain, the length of the nervous network, and the cerebral blood flow start to decrease. However, the brain manages to adapt to the new conditions by forming new synapses at the nerve endings. Changes in memory are a normal part of the aging process. Certain more recent events are forgotten, and names and details are more difficult to recall. The brain, in this situation, can be kept active through regular social activity, regular physical activity, mental activity, physical activity that help to flow and increase the flow of blood and oxygen to the brain. Measurement of the nerve atrophy. Atrophy of brain tissue represents, how is said, a progressive process and involve decrease in the number of nerve cells and interneuronal connection that over time leads to the loss of brain volume, shrinking of the brain, and the reduction of cognitive functions. Progressive degeneration of the brain is a process that occurs physiologically with aging, but it can also be encountered in the evolution of certain pathologies represented by neurodegenerative disease like Alzheimer's disease, which means a severe hippocampal atrophy, Pick's disease, frontotemporal dementia, Parkinson's disease, Huntington disease, and others, but also craniocerebral trauma, stroke, ischemic or hemorrhagic, cerebral infection, encephalitis, neurosyphilis, immunodeficiency, chronic inflammatory disease like multiple sclerosis, hereditary metabolic disease including leukodystrophy, mitochondrial encephalomyopathy. All of these are processes that needs a very good assessment of nerve atrophy level. The treatment of cerebral atrophy is individualized and instituted depending on each individual case in order to slow down the atrophy process and manage the associated symptoms. Non-drug treatment options for cerebral atrophy include physical therapy, speech therapy, and psychological counseling. In the case of cerebral infection that cause cerebral atrophy, antibiotics and antivirals are used successfully. Diagnosis and test. History and neurological examination are basic elements in the diagnosis of neuromuscular disorders leading to the specific diagnostic test. Mononeuropathy and radiculopathy are usually caused by local trauma, and those blood tests are not indicated but not excluded. For this reason, we recommend to make a correct diagnosis of neuropathy based on blood tests, genetic tests, electrodiagnostic tests. In the same time, magnetic resonance imaging to the cervical, thoracic, or lumbar level of spine also could help us to identify expansive processes that compress nerve roots or even root abnormally, can reveal hypertrophy or contrast uptake in patients with polyradiculopathy. Brachial or lumbosacral plexus MRI examination also could be helpful for accuracy of the diagnostic and to see a possibly neoplastic or infection, infiltration, or structural damage. For this reason, we recommend nerve biopsy, skin biopsy, or autonomic function test. Management and treatment. The primary goal in evaluating neuropathies is to identify the etiology and, if it is possible, treat the underlying cause of neuropathy and not the symptoms. However, even when neuropathy has a treatable cause, such as diabetes mellitus, deficit of vitamin B12, exposure to toxin, treatment is aimed at preventing the progression of neuropathic symptoms. For this reason, we have in the first step etiological treatment. That means the treatment of symptoms. The first step in the treatment of painful polyneuropathy is to quantify the severity of the pain and establish the therapeutic target. The treatment of nerve damage. Each type of injury benefits from the specific treatment. In the case of compression, we have an irreversible and progressive situation. That is, once the peripheral compression neuropathy is triggered, it worsens over time. The section of an obligate nerve is treated with neuroraphy. This involves the nerve reconstruction through a microsurgical technique. Microsurgery technique both on over-specialization of the surgeon and the special equipment, and neuroraphy is performed under microscope or magnifying glass. Pharmacological treatment. Use the relief the symptoms of painful peripheral neuropathy. And these include non-steroidal anti-inflammatory drugs, antidepressant, anticonvulsant, opioid, like opioid dependence and addiction, but it could be used, topical treatments, creams, or patches. Non-pharmacological treatment of pain. Physical activity. This is the main accept for and much interesting of person to do physical activity. Due to the multiple benefits of physical activity, including the improvement of other health parameters, it should be encouraged in all patients with painful polyneuropathy to make a physical exercise. Specialists recommend 30 minutes on moderate physical activity daily. Electrical stimulation, spinal cord stimulation. The premise of spinal cord stimulation are the electrical stimulation of nerve roots and spinal column through an electrode placed in the epidural space will act as a gate and block the pain perception without ablation. Acupuncture. Along with chiropractic, massage, and yoga, acupuncture is recommended for the treatment of peripheral neuropathy. A specific treatment is in diabetic and pre-diabetic neuropathy, because here the main goal is the treatment of modifiable risk factors such as hyperglycemia, hyperlipidemia, hypertension, obesity, and smoking, treatment of symptoms, and prevention of complication. Treatment of incarceration neuropathy. If we are in front of carpal tunnel syndrome, is clear that we have a lesion, a damage of median nerve. And in this case, after an ultrasound evaluation for have the specific diagnostic, but also after we make the electrodiagnostic for assessment the nerve conduction, the intervention could be surgical intervention, surgical dissection of the carpal ligament with decompression of the nerve is curative, but is only necessary in severe and prolonged cases. Otherwise, only physical exercise, electrostimulation, and posture, corrective posture of the hand are okay. Immobilizing the feet in splints to limit flexion relieves discomfort. And here you have the reference about our topics, and of course, are many to say about this. In a summary, the take-home messages from this course is regarding how we make the diagnosis using the clinical functional evaluation specific test of nerve damage. Again, to establish the etiology, which is the cause of the nerve damage. That could be trauma, could be different infiltrative process, inflammatory process, toxin process, position, that could make also a mechanical compression or traction of the nerve. This is the form of evaluation. After, we have specific tests from some of the nerves and, of course, test the daily living activity, but we don't forget about the MRI, about the electrodiagnostic, electromyography to have a specific diagnostic. In terms of treatment, the treatment is in according with the symptoms, and the main symptoms could be pain, but also it is in according with the etiology, depend of the cause generated the nerve damages. I hope that we made a short presentation about what means pathophysiology and nerve and which are the main steps for management the nerve damage. Thank you for your attention.